Hello and welcome back to Safety for Cruisers. My name is Eitan, and today we're going to be going over medical gear, what you should have on board, what I have on board, and some good strategies for mitigating and preparing for medical emergencies at sea. So in front of you I have what would be considered my jump bag. This is something I had set up for when I was working as a paramedic. So we're going to go through this briefly just so you can kind of see how I have things organized and some of the gear that I have. But this would be something that I would obviously not expect people to have on board due to the training requirements to have it. But after we're finished going through this, we're going to go over the kind of the two classes of emergencies and how I would recommend that people go about gearing up for those. So this is a Cantara Extreme Bag, super great setup, really nice. It allows you to organize things into different compartments and kind of set things up in the way that suits you best. So what we have on this side is all of our trauma gear. So I know that if anything trauma, I'm going to want that here. I've got my tourniquets, needle decompression, ice packs, hot packs, trauma dressings, flushes, all kinds of good stuff over here. The other side, mirroring this, is going to be our BSI. So that's going to have our gloves, eye pro. I also have my assessment gear, so pulse oximeter, blood pressure, and we have some IV supplies over on this side as well. Moving into the bigger compartment here, kind of unrolling it, we have our airway adjuncts. So we have BLS airways, OPAs, NPAs. We have oxygen supply. If you are a dive boat, and by dive boat I mean you do scuba from your cruiser, whatever that might be, definitely recommend having a O2 kit on board. You don't need to be a paramedic or an EMT to have one. You can get a certification through Dan or Patty, any of the dive companies, and you can actually purchase an O2 kit for yourself. So this has non-rebreathers, cannulas, simple masks, all kinds of good stuff that you could actually have yourself. That's not an advanced skill. That's something that I definitely recommend that all boats that dive have. So this is our adult set, and this is our pediatric set here. Moving into this main compartment, not going to go too in depth because a lot of this is a bit over the top for you guys. This is our suction setup. Again, this is something that'll come with your O2 kit most likely. If it doesn't, definitely recommend you supplement your kit with that. We have our D cylinder in here. Have our ALS medications here. We have some supraglottic airways, and then we have some more advanced airways down here. A little insert here for some assessment tools, random other little pouches, and in this top compartment over here we have our BBM. So that's kind of the setup on this this kit. Like I said, definitely going to be overkill for most people, but it's how I have it set up, and definitely sleep better at night knowing that it's on board. But for people who are not trained as medical first responders, this is kind of where this video is going to be more applicable to you. We're going to go over the two classes of emergencies, and we're going to go over the gear that you should have on board to deal with them. So when I talk about the two classes of emergencies, what I'm talking about is you have medical and you have trauma. So medical emergencies are going to be the usually due to a underlying chronic condition, so it's not something that is going to be as prevalent as trauma, which is the other category, but preparation for them are equally as important. So the other category, like I mentioned, is trauma. On a sailboat, there's obviously a lot of things that you can bump and bruise yourself on, and there's also a lot of things that can cause some more significant injuries. So when you're looking at getting set for your medical gear on board a boat that's going to be offshore and away from assistance, you want to look at those two kind of categories. And the easiest one to address first is trauma. So, you know, we've got this bag, I've got extra med gear over here, we've got a whole bathroom full of first aid supplies. Out of all the supplies on board we've used so far, the by far the most common has been Band-Aids, has been like wound cleaning, so basically denatured alcohol or hydrogen peroxide, and some sterile pads, and OTC medications. That, knock on wood, has been all we've had to use so far, and that's going to be the case for most cruisers. So the while yes, you do want to have for trauma, you want to have things like big abdominal pads and big compression dressings for more serious injuries. You really want to make sure that you're set. You've got good bandages, you've got different size, different fits, waterproof, non-waterproof, because again, the most likely things that are going to happen on board are going to be little cuts, bruises, scrapes, things like that. So you want to have a really good, just generic first aid supply. Have triple antibiotic ointment, Neosporin, maybe some local anesthetic, little Neosporin with lidocaine, something like that. So just your basic first aid supplies are going to be a really big part of your med kit. So I kind of just have this separate from our emergency. We kind of have our non-emergency and our emergency kits. And that non-emergency is obviously going to be the most common. Moving into some other gear that's beyond just kind of bandages and ace wraps and triangle bandages to splint extremities for things like that, into some more advanced things that I recommend is one of the single biggest life-saving appliances you can have for trauma is a tourniquet. There's propellers, there's all kinds of different things on boats that can cause some pretty severe bleeding, and if you aren't trained to stop it with applying the correct amount of direct pressure to the right places, you can end up with a bleed that could cost somebody their life. And a very, very easy device to mitigate that with is a tourniquet. So got a couple spread over different places in the boat. You want to make sure everyone knows where they are and how to use it. We'll kind of circle back to this, but just a quick cliff note is one of the most important things you can do for medical emergencies is training. So go out, get trained. We'll talk about that a little bit later. So tourniquets are one. Suture kits are another for people who are going to be really far out. If you're just cruising offshore in the States or offshore in Europe, somewhere that has a very robust Coast Guard and easy, quick evacuation to medical facilities, then things like suturing are not going to be as big. But say something happens on your crossing from Mexico to French Polynesia, you could potentially have 2 weeks, 3 weeks until you get to medical care. So at that point, a suture kit, some wound closure strips, things like that are going to be able to take you from just putting a bandage on something that could potentially heal up in a really weird way because of potentially the size of the wound, to you being able to suture that close and turn that into a more sterile, more secured, and much less painful injury for that patient. So tourniquet's big. Wound closure, a little bit more advanced wound closure is good. You want to have stuff for wound cleaning and irrigation. So some sterile water. Yes, you can use filtered water, from the tank. You could, from a bottle, something like that. But having sterile water on board is really good because some things, whether it's an eye injury that you need to flush extensively or just a large wound that you have to really irrigate and debride, that can be a really good thing to have, and a lot of people overlook that. So some sterile water or some sterile saline, also your basic stuff like I mentioned, denatured alcohol, hydrogen peroxide, just your rubbing alcohol, whatever you can find in the stores, just to clean out those cuts. So that's your trauma stuff. Another good thing actually to include in the trauma thing is going to be hemostatic agents. So again, this does require a little bit more training like a tourniquet, but hemostatic agents or hemostatic gauze is going to be for stopping injuries that are somewhere that you can't put a tourniquet. So high up in an armpit, groin, something like that. You don't pack cavities, so abdomen, chest, nothing like that. But if for some reason you did get somebody with a penetrating injury that was bleeding a lot in one of those areas, hemostatic agents can be a really good supplement to your kits as well. Moving into the medical, the biggest thing you can do for medical is to make sure that you and your crew are prepared to manage chronic conditions. So if you've got a crew of young, healthy people who don't take medicines on a regular basis, who are up on their annual physicals, medically there's not going to be a lot that you're going to need. There could obviously be things like people getting food poisoning, things like that, but most of the issues that you see on long-term cruising boats are going to be from pre-existing conditions that are either not cared for or get out of hand while underway and away from medical care. Especially if you're an older boat or you have older people on board, you need to make sure, say if you're an asthmatic, you're not just taking your regular inhalers that you use, but you've also got enough rescue inhalers that can last you for however long. So you might want to go to your doctor and say, hey, I know that I normally use just albuterol for my rescue inhaler, but I'd also like to get, a Solumedrol prescription or something, just taking that next level up. So really important that everybody on board manages their chronic conditions beforehand and while they're underway. And it's also important that you're open about what conditions you have with your captain and with your other crew. Obviously, they can be sensitive. You don't need to disclose every little detail, but if it's something like, hey, I'm a diabetic, I need to have my insulin injection at this time every day, that might be something that would be good for other people to know, because if it's 1800 and you're supposed to take it at 1600 and you start acting funny, then somebody can say, oh, well, maybe they haven't had their insulin. That's not a great example because hyperglycemia doesn't progress that fast, but still. Disclosing conditions is very useful. It's not ideal to tell somebody, oh, by the way, I have a heart condition, as you're getting palpitations 2.5 weeks from any advanced care. So really big to manage those pre-existing conditions. The other things that we mentioned are going to be your environmental things. So this is going to be your food poisoning, contaminated water. You can throw in, jellyfish, stingrays. That's a little bit more on the trauma side. But the environmental things are going to be big. So that goes into kind of the medication side of things. We're fortunate enough, we're in Mexico right now. You can buy absolutely anything you want over the counter. No prescriptions, no questions, nothing. So great place to stock up if you are going to be going somewhere remote, or if you live in a place like the US where you can't get amoxicillin without a 25-hour ordeal going to your doctor to try to explain to them that you just need it for cruising and that you're not actually sick at the moment. So a lot of countries are like that. Really good to have a good supply of medicines, and some good things to cover are going to be antidiarrheals. So a lot of that can be OTC, but you want to make sure you have a good supply if you do get a nasty bout of food poisoning and you're single-handing, or you're, you got 2 people and you're underway. You might not have the luxury of just laying in your bunk for 24 hours while you recover. Antidiarrheals, antiemetics, obviously a huge issue for people on the sea and cruising is going to be seasickness. So you want to make sure that people who are prone to seasickness have medicines and have a good stock of them in advance. They know the difference between, the scopolamine patch has to go on 4 hours before, and I can use this many before I have to take a break. They know that Zofran can only be taken Q4 if it's a 4 milligram tablet, whatever the prescription is from your doctor. You want to make sure that people aren't popping pills and combining them and doing weird things just because they're feeling seasick. So you want to make sure that people are managing their nausea if they do get seasick appropriately. But even outside of seasickness, kind of back to the food poisoning stuff, it's good to have antiemetics, a good supply, a good variety on board for your crew. That being said, one of the hazards of being in a place like Mexico where you can buy anything, is you can buy a medicine, you can give it to someone, and they don't know they have an allergy, or they don't know that it's going to react badly to something else that they're taking. So it's super huge and super important when you're looking at provisioning your kit to get medicines that you've done as much research as you can. And if you take amlodipine, if you're taking a beta blocker, if you have X, Y, and Z underlying conditions, you don't want to, and you live in the States or you have anywhere where you have a primary care doctor, you don't want to wait until you leave to figure out that, oh, actually, this med that I'm taking for my hypertension interacts with this antiemetic that I take because I'm seasick. Super sketchy thing to do. You want to make sure that when you're provisioning up, that you're talking to a doctor, you're talking to somebody that knows the interactions for these medicines, a pharmacist. Anybody that you can get a hold of as a good resource so that you know what interacts with what and what is safe to take in what doses. The kind of next category to go into, we talked about the GI things, is kind of moving to GU and abdominal, is going to be your antibiotics. So antibiotics work fantastically in most cases, but you need to have the right antibiotic for the right thing. If you get a really horrible bout of food poisoning and you're suspecting it's bacterial, that antibiotic is going to be different than the antibiotic you're going to take if you get a super nasty gash on your arm from a potentially infected object. That's going to be different than the antibiotic you're going to take if you think you have a UTI or a bladder infection. So it's important to get the correct antibiotic for the issues that might happen. So we have 3 different ones, and they're all different families. They're for different things, and that selection is something that I came to after talking to, even though I'm a paramedic, talked to a couple of doctors, a couple of nurses, a couple of pharmacists. I'm like, hey, what do you recommend? What's going to be a good broad spectrum for X, Y, and Z? Because my training is in emergency medicine. If it's not going to kill you in the next hour and a half, I probably haven't heard about it as much as somebody who's had a little bit more advanced training. So super important to pick out your antibiotics, and again, to make sure that those medicines are not going to react with any medicines that you're taking. So that is those are kind of your big ticket items on the medical side of things. The other kind of caveat to throw in a bit of an overarching category is going to be your pain management. Pain management is super critical, like antibiotics, to make sure that if you're buying stuff that's normally prescription, that you know the dosage, that you know the interactions, because I can go out and I can go to, our next port's going to be wherever. I can show up to a pharmacy and say, hey, give me enough oxys to kill an elephant, and they'll say, perfect, here you go, no questions asked. That's great, but if you don't know what the correct dosage is, and you don't know that that's going to interact with this medication that you take, then you might end up with a lovely overdose situation, and if you don't have any Narcan on board, which I highly doubt you do, then you got a big problem. So pain management's good. Obviously, Tylenol, ibuprofen, your basic OTC stuff's good. I do recommend people have stronger stuff, because again, if you're out in more remote areas and you don't have the ability to just lay in your bunk and you actually have to function and get yourself to care, then you might need to take something stronger. So there's all different kinds of medications, NSAIDs, opiates. Find a good strength and a good type that works for you physiologically, for the crew that you have on board. And another thing that can be good to supplement your pain management with is some muscle relaxers, because if you get a musculoskeletal injury, then yeah, you could take some opiates, you could take whatever it is, but if you have a muscle relaxer to ease the actual cause of that pain, it's always better to do that than simply masking it. So those are your big medical concerns and medication kind of mitigation possibilities. The other thing to go over that I said we were going to loop back to is training. So if you want to go out and do an EMT course and you've got the time and the money to do it, fantastic. If you're going to do a WEMT course, I'd recommend that, honestly, over a regular EMT course. It gives you a good basic understanding of things. If you happen to end up with a paramedic on board, fantastic. Dish that all out to them. You don't have to worry about it. But obviously, most people aren't going to do that. So a couple things you can do is either take some first aid courses. You want to be trained in CPR. You want to be trained in first aid. You want to have at least thought about this kind of thing so that if something does happen, you don't freak out. So going out and getting some basic training is really good. And then also getting a medical encyclopedia. So whether it's an app on your phone, whether it's an actual hard copy book, getting something that you can look up if you don't have a cell connection, or you don't have a satellite phone capabilities on board, getting something where you can look up and you say, okay, I have pain in my right upper quadrant, it's been going on for this long, it feels this way, it radiates this, it hurts more when I lay down. You can look up all those different symptoms and you can try to come to a differential diagnosis, and then potentially out of your med kit, prescribe yourself the appropriate medication for that. It's not ideal, and if you do have a phone, if you do have a you do a satellite connection, I would obviously recommend calling somebody. If you can set up with your primary care doctor, say, hey, I'm going to be going on this trip, can I have an emergency number to call if something goes wrong? Because obviously you can't just call 911. They're not gonna be able to help you. They're not gonna kit it out for that. So having I mean, if it's a doctor friend, if it's a pharmacist friend, if it's a nurse friend, obviously consult them and see if they're able and willing. Not all nurses are created not equal. Not all doctors are created equal. Not all medics are created equal. So watch out who you pick. But having a source of online medical control or online medical resources can be super helpful in addressing any situation that you have. But kind of to wrap things up, that's a lot of your chronic stuff. In emergency management, stay tuned for the next video, which is going to be the psychology of emergencies. In emergency management, it's a very simple process. A, B, C. Airway, breathing, circulation. If the air is going in and out, there's oxygen being exchanged, and the blood's going round and round, you're good to go. Air in and out, blood round and round. You keep those two things going, you're going to be fine.